right, well, welcome everyone to today's webinar. This is the Aging Initiative MCC Scholars Program Information Session. And this webinar series is coordinated by the Aging Initiative. So for those of you who are wondering what the Aging Initiative is, it is an NIA-funded initiative that bridges the expertise and leadership of two sort of powerhouses on research for multiple chronic conditions. The two powerhouses are the Healthcare Systems Research Network and the Claude D Pepper Older Americans Independent Centers, or Pepper Centers. So this Aging Initiative is led by Dr. Jerry Gurwitz at University of Massachusetts and Meyer Healthcare Institute, along with the co-PIs who are Elise Adams and Jay Magaziner. And I'm Heather Whitson. I'm a professor of medicine and the director of the Duke University Aging Center, and I am part of the Aging Initiative Dissemination Workgroup, which is co-led by Dr. Leah Hanson at HealthPartners, who you'll hear more from in a moment. We are also joined today by two Aging Initiative Patient Caregiver Advisory Council members, that is Sherry Benz and Rosie Bartel, who will be co-presenting with us and providing more background related to the stakeholder impact of the MCC Scholars Program applications. So because we had a number of registrants today, your phone lines may be on mute just to reduce audio feedback during the presentation. If you are not able to unmute yourself later to ask questions, then we do appreciate you using the chat function to raise any questions that you'd like. This is your informational webinar and your time to sort of ask questions, and we'll do our very best to answer them. We are going to start out with sort of some slides and presentation, and then we'll kick it over to you for time to ask your questions, and feel free to submit them through the chat even as the slides are being presented. All right. We can go next slide, and I'm kicking it over to Leah.
Thank you, Heather. I think we'll go one more forward. Again, we wanted to start with just a little more background about the Aging Initiative. The AGING is an acronym for Advancing Geriatrics Infrastructure and Network Growth. We're funded by an R33 award from the National Institute of Aging. We're really excited. This is our third funding opportunity together. We started as an R24, then moved to an R33, and this is our renewal has just started this fall. On the next slide, it will show you just a map of where our member sites are. So the OAIC sites are kind of in the yellow, green, blue are HCSRN, and then the kind of emerald green is where we have both. So we have a pretty widespread on the coast. We have some regional kind of central locations, but there are a few empty areas there. But the overall goal of the Aging Initiative is to create a national resource that nurtures and advances science on multiple chronic conditions, or MCCs, and really looking to address the knowledge gaps that we have that exist in health and healthcare for this very understudied population. Next slide. So why MCCs? MCCs, or multiple chronic conditions, really are the most chronic conditions. So the existence of multiple chronic conditions, more than 77% of people age 65 and older have at least 2 or more chronic medical conditions. And we know from the literature that in clinical trials, people living with multiple chronic conditions are frequently excluded from these studies. And so we have limited evidence on what's best care for people with MCCs. So in terms of use of healthcare, people living with MCCs are the heaviest users. So the 12% of Medicare beneficiaries that have 6 or more chronic conditions account for 50% of hospitalization spending, 43% of total spending, and nearly 70% of post-acute Medicare costs. So there's a lot of room, there's a large gap and room for growth and needing to understand how to improve outcomes for people with MCCs and how to also reduce healthcare utilization and costs. Next slide, please. So this is a quick org chart, and I know the words are small. The bottom right, you can see Heather and I in the Career Development Core. We also have a Dissemination Innovation Core, a Methods and Measures Core, and again, Jerry Gerwitz as our fearless leader, and then Elise Adams and Jay Magazine are up in the co-PI roles. And as we go into our curriculum, you'll see how you can leverage this really great group of people pulled together in our steering committee and our external advisory committee, as well as our cores. Next slide, please. So to date, the MCC Scholars Program, we've hosted more than 70 webinars. Wow, that's a lot. I didn't realize it was 70. And we've had 5 MCC Scholars Workshop. And we've trained 56 early career investigators from really a wide range of interests across our 5 cohorts of MCC Scholars. So we're excited. This is our 6th cycle for the MCC Scholars Program. Next slide. So what is the MCC Scholars Program? Again, we're looking to create a cohort of emerging leaders that are committed to MCC's research. This year we will be selecting 14 scholars, and there are several components of the program. The first one is in-person attendance at a workshop that will be held together with the OAIC annual meeting this year, next year in 2024, that will be held in April. And then over the year following that in-person kind of kickoff at the workshop, there will be 6 webinars that will be focused on the 4 different parts of our curriculum, in addition to a mentoring program, which we'll describe in a more detail in a little bit. And again, just really becoming a part of this nationwide community and joining our community of scholars and our group of experts and great senior scientists with experience in MCC's research. The next slide shows just a figure we've created. We call it our stool. So the 3 legs of our stool where our curriculum is delivered are: first, the significance of multiple chronic conditions; second, enabling meaningful patient caregiver engagement; the third is resources and tools for MCC's researchers, including methods; and then sort of the seat of our stool at the core of everything is career development for our early investigators. Next slide, please. So the 6 in-person, the in-person meeting plus 6 webinars component, here's an example of how that might look during a year in the Scholars Program. The kickoff in April as an in-person workshop, and then having about 1 webinar once every other month. And we have 2 types of webinars. One is a public webinar. The other is a scholars only webinar, which is a smaller group, more intimate conversation on a specific topic. And so we will be rotating through the different parts of our stool, of the 3 legs and the seat. And so this is an example of how the year of curriculum may look. And now I'll pass it over to Heather if you want to go into some more detail around our mentorship.
Sure. So this year, we're sort of, as we said, we're going into our 6th year of recruiting a cohort, and we're responding to feedback and suggestions from prior MCC scholars who have been part of annual cadres in the past. And one of the things that they talked about that they loved was the sort of networking opportunity, not just with the peers and the other scholars, but the networking opportunity with the senior investigators and senior advisors that are part of the Aging Initiative sort of community. So that includes the other core leaders, the steering committee, the PIs, and then very importantly, the APCAC advisors. So you're going to hear from 2 APCAC advisors shortly, but one of the, as you saw, one of the 3 sort of legs of this three-legged curriculum is to train you to work with and engage with from the beginning of your idea through the end of your idea and dissemination at all stages of research, patient and caregiver advisors, and to really sort of incorporate patient and caregiver advisors as part of the research at all stages. So it follows the sort of research advice of nothing about us without us. And so throughout the year now, what we're sort of adding in is these opportunities that once a month, you'll have another opportunity to sort of interact with a person that we're calling a mentor, advisor, maybe a more accurate term. There'll be one sort of you'll be paired with one mentor or advisor representing each of our three stools or stool legs, and then also a peer mentoring group, a smaller group within your cohort of 14 MCC scholars. So next slide, we'll sort of show you how this is going to look. And so again, this is just an example of how a scholar experience might be laid out. But if you look at each month of the year that you're participating in the MCC Scholars Program, you would have this sort of monthly meeting, and it would, at each monthly meeting, you'd show up to interact with either a one-on-one time with your paired mentor or advisor in the different sort of theme areas, or have a peer mentoring group where a handful of 3 or 4 of you come together for a Zoom meeting and discuss topics, and we would have sort of a guided conversation there. So in terms of thinking of time commitment, because I will say one thing that we try to be very conscientious about is the fact that, this is a scholar program where you don't get protected time. So this doesn't come with 5% protected effort or something like that. It's time that the scholars sort of make and commit themselves to the experience. But because of that, we really do try to keep your time commitment to a minimal and yet very high impact for the time that you do commit. So again, whereas we used to have the one in-person meeting, and then over the course of the year, there would be these 6 kind of webinars. This is adding in another monthly experience, but this was something that past scholars all felt that the events that they had throughout the year were high yield enough that they wanted more, not less. So we're adding more, and we hope that that you'll find this as additive to your careers as other scholars thought that you would. All right, next slide. And then there are just those sort of intangible benefits that you can't quantify exactly. I think that the friendships and the bonds and the sort of networking and the trading of ideas and support for each other has been kind of one of the hallmarks of the program, that the various cohorts have taken opportunities to really bond and to build in some cases very meaningful work collaborations throughout the program. There's also opportunities to get your grants or your Ames pages reviewed, to obtain senior mentorship and reach out to people and develop relationships, and in some cases job opportunities, interactions with NIA representatives, many of whom attend the inpatient conference that kicks off the program. And then again, sort of exposure to the resources of these 2 sort of national strongholds, the Healthcare Systems Research Network on the one hand and the Pepper Centers on the other. Next slide. All right, so who should apply? Anybody with what we sort of, we stopped trying to list all of the potential degrees that you might have, but we call it sort of an MD, PhD, or equivalent degree, which could be sort of a doctorate level degree in any sort of health allied type field or profession. And the ones that we're showing there, I think we've had someone representing all of those, but All are welcome. And if you have any questions about whether your degree counts as an equivalent degree, feel free to ask. We also ask that you show evidence of commitment to research, and then in a field that is relevant to MCCs or aging. So please, I want to underline there that it doesn't mean that you have to have already published extensively papers that talk about MCCs and multimorbidity, but rather that you're in a field that you can really make a case and articulate why it is that this additional training in this topic of multiple chronic conditions would add to the career that you're in. If you already are publishing in this area, that's great too. But I don't want to scare people away who may think, well, I'm in a career that I think is relevant to MCCs, but I haven't established a track record in that field. That's okay. You just have to tell us how this is going to add to the track record that you do have. In addition, we give preference to applicants who are earlier stage. So typically this will be somebody who has not received an R01 or equivalent grant, has not yet received tenure, or has only very recently attained those things. We do ask that you commit to attending the workshop in April. That 2-day in-person experience is really important to setting the stage for kind of the rest of the curricular year, and that you agree to participate in those 6 webinars that happen. In addition, with our new program, we're asking that you commit to these sort of regular monthly meetings with assigned mentors, and we will do our best to work around schedules to accommodate that. We also strongly encourage applications from groups that are underrepresented in research. This can include women, people from minoritized ethnic or racial populations, people with disabilities, and the other categories that are established by the NIH as underrepresented in medical research. And then we are absolutely looking for applicants who are coming in because they wish to collaborate. They're looking for the network. They want to interact with other people as part of this program, and who have ongoing research activities that, again, you can tell us how these activities might be enhanced by the data resources or the expertise that you would be gaining access to. And that includes access to the APCAC, or the Patient and Caregiver Advisory Council, which we really see as one of the very rich aspects of this program, is to receive training in how to engage and how to incorporate patient and caregivers into your research. And again, just as I said about the multimorbidity, that doesn't mean that you have to show us a track record that you've already been doing it and you're doing it like an expert. In some ways, we understand that this may be something that you are wanting to do, open to doing, but you haven't received tools or training to be able to do it. But we need to hear about how you're open and willing and eager to learn, and how specifically this will enhance, or how you would incorporate patient and care partners to enhance your research. Importantly, you do not need to be affiliated with the HCSRN or the Pepper Centers, the older American Independent Centers already. Next slide. All right, so how do you apply? There's an online application. You can find it here. We'll also be circulating it, and it's a fairly straightforward application. You're not here submitting a particular research project that's being reviewed. We're really sort of reviewing your track record and your research program, if you will. So in addition to giving us a little bit of institutional and sort of demographic information, you'll upload your biosketch and then provide just short responses that you're only allowed 400 words of text for 3 different prompts that you can see here. And again, this is your opportunity to sort of tell us how particularly collaborative research is something that you have done, and how it would help you in the future. Work on multiple chronic conditions, how this would be incorporated into your research program, and then how the participation would contribute to your long-term goals and career plan. Next. Okay, so how do we review these? So we base the selection of applicants partly on evidence of commitment to and productivity in research that is, again, relevant to multiple chronic conditions and appropriate to your stage of career. Also, with each year, we try to make sure that the cohort that we bring together each year brings a lot of diverse perspectives and expertise. So we want a group that is complementary in terms of not just their sort of demographic backgrounds and institutional variability amongst them, but also that they bring in sort of different, a mix of MDs, PhDs, people from different fields of medicine and methodology to be able to inform each other and make it really a valuable peer mentoring experience. Each candidate is reviewed by 2 scientific reviewers and 2 patient caregiver advisor reviewers. And then the reviewers all score their sections of the application. Again, you'll hear from the patient caregiver advisor representatives here about some of the things that those 2 reviewers are looking for in the applications. Oh, and I see, thanks, Leah. She just popped the link into the chat. Next slide. All right, and with that, I think I'm going to turn it over to our patient caregiver advisors and let Ms. Spins and Ms. Bartel tell us more about their experience with this program. All right.
Erin, next slide, please. Rosie and I are part of the first contingent of patient caregiver advisors that were added to this initiative 6 years ago now, I think. We have currently 8 or 10 of us that are still active in this advisory council. There's a great deal of differences in our backgrounds. Some of us are caregivers of elder parents or spouses. Some of us are living with multiple chronic comorbidities. There's also a great deal of wealth within that group of research experience and higher education, including we have one patient caregiver advisor who has been teaching anatomy in a medical school for years. So, you know, again, there's a wide variety of people who are coming in with a good background, knowing when you hit the ground running that we can keep up with you. And we're not going to pull you back because we are educated advisors. We're located all across the United States.
Right, and we have a really strong background in cooperating and working with other researchers. It's not just we've worked with for the last 6 years. Sherry and I, from the day one, almost started working with a researcher, but we have worked with researchers in our past life before this. So many of us are really connected to PCORI and our PCORI ambassadors. So we have a research background and especially a patient-focused research background. Next slide.
I think one of the things that we're looking to on your application is what you have done, what kinds of interactions you've had with patients in the past. People that don't really show much of a skill for or a history of patient engagement might not score as high as those that really have interwoven that into their plan of action as you rise through the ranks of doing research and scholarly work. So we really want to also see from you what your goals are as far as impacting the lives of your patients and their families, and realizing that you're not just treating an individual, you're not just working with an individual, but you're working with their whole support system.
Yes, and we are not just a group of people that get together for meetings, but we are a group of people who are connected. in lots of ways. I also saw a note in the someone asking, do you show a reference to rural? One of the reasons I'm here is because I'm rural. I come from a very rural area. I live in a little town that's got about 4,000 people. It has a 21-bed access hospital. I have experience with, very rural situations and rural hospitals. I was just before this meeting, I was talking to one of the people and said, one of my goals in life is to take the research that you use and create and take it to these rural hospitals that maybe never hear about these things, that might sit on a shelf somewhere in a academic world. One of the things that I want you to be really assured is that not just one, but two of us review every one of your applications, and we discuss it. And we also discuss it with the scientists. So if you come out really high on science and you don't come out so high on patient experience, we go back and we discuss where might we be able to help them, where might we be able to see this in a little different light, because it's happened that things have come one way or another, but sometimes I think you need to dig a little deeper and go into that experience, that lived experience of your patients or of your experience, even your personal lived experience. Sometimes you don't realize what you do know. I think I heard Heather say, "Nothing about me without me." And I think that is, I live by that. I don't want anything out there about me without me. And, and I also live by what matters to me and what matters to the people around me, that those are things that are more important than sometimes the medicine and the science. But what really is, what do I want to get out of life at this stage in my life with the situation I'm in? And so I look at things differently with different lenses than maybe somebody else does.
I think also Heather mentioned the friendships you develop through this program. This program is probably more about relationship on all levels than most scholar programs are, because you've got so many layers of that relationship. You've got your fellow scholars to relate to, you've got your scientists to relate to, you've got your advisors to relate to. And there's just a richness in the way that all of that is woven together. So if you're applying for this grant just to get access to data and do some numbers crunching and get feedback on that, this may not be the program for you, because you really have the opportunity to develop bonds, to form relationships that will last you for the rest of your careers.
And those relationships sometimes take you to a new level of care for all of your patients, not just maybe the patients that you talk about in this application, but it might help take you to a new level of relationships with all your patients and families. I think we could go to the next slide.
One of the things I like about this slide, I was at a research conference probably 10 years ago, and the researcher was at the center of this diagram. And after discussing the fact that research isn't about the researchers, it's about the targets of their research, this gradually came to put patients and caregivers at the center of that. The work that we do within this aging initiative is all about impacting positively the lives of our patients, the lives of their caregivers or care partners. And you just have a unique opportunity here to design research, to learn how to do research that has that positive impact by using the things in the bubbles outside of that to design your research and to guide you through that, so that your patients and your caregivers are impacted.
Yeah, you're on, this research through this program or this grant would probably move you to a new level of research. And I agree with Sherry. I've seen the same thing where the researcher was in the middle and we were off to the side somewhere. And I've worked really hard to make sure that patients and caregivers are in the middle, and I know Sherry has too. But also, I think I like the one where connecting academic and health system researchers. I think sometimes we are really focused on academic research and we forget that there's health systems out there doing some really good research too. And so you might be in a rural area that's working with a health system that is doing some research, and that might be the perfect place. And this might be the perfect place where your research might float to the top or come to the top, because it's not just about the academic, but it's also about how is this going to impact health systems across the world, and especially across our country.
Thanks, Rosie. Next slide. Is this our last one? Okay.
Yeah, I think it goes back to us. So thanks so much. And I think we have just about 3 more slides here. So I'll try to wrap up. The applications are due January 8th. The scholars get notified February 5th, which hopefully gives enough time to be able to book travel for that meeting that is April 24th through 26th. But we do ask that if you are going to submit an application, that you go ahead and hold that time, because if you're notified February 5th, that is a required expectation of the program that you attend that meeting, that you commit to attend. One thing that I was going to just mention is again to kind of reiterate that we realize that many of you who are applying don't have patients because you're not clinicians. Maybe you're an epidemiologist or gerontologist, and so again, we've had many people who have come into the program and said, I had never been able to engage with patient or caregivers before because I don't have my own patient population, and I don't have a mentor who's ever done that or made that something. I had no idea how to reach people, and that's a lot of what this program's supposed to train you to do. But at the same time, I think being really explicit in your application about how you would incorporate that, where that would and how that would improve the quality of the work that you're doing and open up new doors for your research is really important. Next slide. So you can find more details at these links, and contact Ollie DeRochers, who does amazing work behind the scenes, along with Erin Maddow, who's on today. And we do have I think in the next slide is some frequently asked questions. There are more FAQs on those websites, but these are ones that always come up. So does your research have to be about older adults or aging? So again, it doesn't. While older adults are the largest population with multiple chronic conditions, there are certainly many other populations that are at elevated risk of multiple chronic conditions, and we welcome people who focus on any of those. Some people have come to us and said, I'm a graduate student, I don't have my PhD yet, but the application said I need to have that terminal degree. Can I still apply? And unfortunately, we've had to say that you do have to have that degree at the time that you're applying. And then a question is, can international researchers apply? And yes, they can. We have had international applicants. You do have to, again, this year commit to being in person at that program. But assuming that you would be able to get yourself to that program, we can receive applications from international applicants. And then if you have previously applied, does that count against you? And it's actually the opposite. It kind of counts for you. So every single year, we've been really fortunate to receive twice or more as many super qualified, amazing applications from amazing people. And we were just sad that we didn't have the spots to accommodate all of them and keep this kind of an intimate experience. So we do keep track of repeat applicants. There's a place on the application, I think, also where you check if you're a repeat applicant. And we do try to to pay attention to that. So if you're somebody who's applied before in the past and you did not get accepted, don't in any way think that that will count against you. Remember that one of the things that we do every year in trying to come up with our cohort of 12 to 14 that get to come into the program is to make sure that we have representation of people from across geographic areas, different scientific backgrounds, and demographic backgrounds as well. So sometimes it's just that we were blessed with a really large number of qualified people, and yours was not. The reason you were not selected had nothing to do with the quality of the application. So please do come in again.
Heather, the other thing is, you mentioned the fact that some of them may not have patients and they may not have that patient experience. I know that the first time that Sherry and I did this for you, we one of your applicants reached out to us before the application. And so please share our emails with them. And, you know, I'm willing to help anyone. To me, my past life was education. And so to me, this is like gravy to me. It's like so important to me to help people, you know, have the experiences they need and get the background they need and talk to the people they need to talk to get the experience they need. So don't feel free to reach out to me. And I know Sherry feels exactly the same way, because that time we both met with the young lady, and you know, it was we couldn't judge her at grant, but we could help her before time, and to me that was much more rewarding than having to review her grant.
Well, that's incredibly generous, and I would say very, very typical of the passion and the willingness to help that we've seen from the ABCAC advisors. An amazing asset. So thank you. Thanks for that.
Heather, it looks like we do have a few questions in the chat, which I think we can go through. And if anyone else have a question, please do type it in the chat. A question is, where does the in-person meeting take place? And I think typically it's in the Bethesda, Washington, D.C. area, probably close to the DCA airport. And let's see.
Yes, and that's purposefully because that makes it easy for the program officers to attend. So there are a lot of program officers who attend that meeting, so it's always in that area by NIH.
Another question is, how many scholars are MDs versus PhDs? And I don't know if I've calculated it, but it seems like maybe half and half or close.
My guess. My guess was about half and half.
I think this year 6 or 7 out of the 12 were clinicians.
The pharmacists and doctorally prepared nurses, social workers, psychologists. So it's across that whole spectrum. Can K1 awardee apply? I'm currently in year 1 and the training emphasizes clinical science.
Yes, you can apply.
Another question, do you recommend this program for postdoctoral fellows? I've noticed many current scholars are assistant professors. Do you have any recommendations for postdocs, since our research will be in very formative stages?
So we certainly have had people that are postdoctoral fellows, right, Leah? I don't think you have to be a faculty member. We do try to, we remind all the reviewers to judge the application based on the stage of career. So people should sort of calibrate their assessment of your track record based on where you are on the track.
Do you have to have prior experience with electronic health records?
No, there's no requirement at all for having that prior experience. In fact, I'd say we've had some investigators who are entirely qualitative in their methods.
I will say that if you go to the Aging Initiative website, that there is a space to see what the qualifications, areas of interest and expertise of the advisors are as well in bulleted format. So if you need to speak with an advisor about developing your application, you can certainly find one of us that has maybe some similar experience, similar education, maybe even to what you're going through right now, and sort of eyeball who you might best be paired up with at the moment going through the process. If you are accepted into the Scholar program, we will pair you with an advisor a couple of months in. So, but just feel free to go into the website and look and see what is currently available.
And if you think of any questions after listening to this webinar, please feel free to email us, and we'd be happy to get that answer back to you.
Right. I think not seeing any additional questions popping up in the chat. I just want to thank you all for your time and interest in participating in the webinar. And we look forward to receiving applications from you.
Thanks, everybody. Have a good afternoon.
Thanks.
Thanks, everyone.
Bye.
All right.